One of the research works that I'm very proud of is, work that actually comes as a result of collaboration with other researchers, especially from different disciplines and also different skill sets as well. I think that's, the most rewarding thing is to try and work towards a goal with other people and other researchers and like-minded people.
There's really been a revolution in the way we treat some cancers, which is with a new treatment called immune therapy or immunotherapy. And these treatments are totally different to traditional treatments like chemotherapy or radiotherapy because they are trying to harness the power of our immune system to treat the cancer. The hope or the promise of bringing those immune treatments to more patients really excites me. And it's exciting really to be an oncologist at this time, and I really feel like we're living through a revolution in cancer treatment.
I'm proud of all the research because I think that we're doing our very best to make a difference. But I think particularly the successes, which can be few and far between in research. But I think if some of the successes, for instance, that we've had in the lab have resulted in clinical trials. And so there are trials out there at the moment in which children are receiving a new therapy to see if that will actually make a difference to their outcomes. And I think that really is why we do this research, is to ultimately make a difference to the health of those children.
It's the patients and their caregivers, I think, that drive me forward. When a patient is diagnosed with a tumour like a brain tumour or a lung cancer, it's a very difficult time for them and their loved ones. And you see this community of love and care surround the patient, and everybody wants to work together to give that person the best.
The part of my research that I'm excited by the most, or that I love the most, is finding new and exciting things that are actually going to make a difference to, young children who are suffering with cancer, potentially providing better therapies so that they have an improved chance of survival, but not just improved survival, it's about having a better quality of life.
The way that I like to say that what I do in my research is that I like to develop tests where we can diagnose cancer better and also track cancer better in patients that have blood cancers, but also other cancers as well.
I came to Monash because I really was passionate about combining clinical care for cancer patients with research, and I see Monash as being a very exciting place for that.
The part that I'm excited about from a clinical research point of view is that we've got a number of clinical trials that are open, and that we're the only institute at the moment in Victoria that's investigating a drug, an immunotherapy drug for acute lymphoblastic leukemia, for example, in children.
We rely on the clinicians to design clinical trials, to conduct the clinical trials. During our research, it's essential that we can get access to clinical samples, which we can't do without Monash Health and without the clinicians.
You don't just get the cross-collaboration, but you also get a much more efficient way of advancing care, because each really needs the other to function and to excel in terms of discovery-based.
And I get asked also, will there ever be a cure for childhood cancer? Well, the cure rate for childhood leukemia has gone, in my practicing lifetime, from 70% to greater than 90%. And, that's a remarkable achievement. In fact, I think acute lymphoblastic leukemia of childhood is the success story of the 20th century in cancer medicine. But all that does is make us want to be able to do better for the other things, and that's where the research comes in.
Ultimately, what we try to do is do the best that we can to help patients and better their care.
Seeing my patients go through what they have, their treatment with bravery, I guess with hope and with optimism, even in some of the darkest times in their lives, really gives me the strength, I guess, and the impetus to keep driving forward in my cancer research.